This segment sponsored by GBMC Healthcare.
What happens if you or a loved one is unable to speak for yourself? Gilchrist Dr. Anthony Riley is here to talk about advanced care planning. Welcome to BMore Lifestyle. Now, what exactly is advanced care planning? What does that mean?
Advanced care planning is an important thing for people to do.
Gotcha.
It's a process. It's a process of discovering and preparing for what major medical decisions you would make in the future.
Understood.
It has two steps, and they're pretty simple steps. The first is the easiest step, that is to name a healthcare agent.
Gotcha.
This is the person who would make decisions if you're unable to.
Gotcha.
And I can talk more about the second step. It's a little more complicated. But the second step is doing the medical what-ifs. It's an exercise of what if things happen medically.
Gotcha.
What would I want to have done if I'm not able to talk about that? An example would be, and forgive me, an example would be the motor vehicle accident where the person is now in an irreversible coma.
Right.
Families that have done this really have benefited from having that kind of advanced care planning.
Gotcha, I'm glad. Now, Tuesday, April 16th is National Healthcare Decisions Day, which focuses on the importance of advanced care. How important is that day?
This is a day that we use to remind people that this is advanced care planning is a process, something that it's not one and done. It's best to do it on a regular basis. And this day is designed to remind people that they should do this advanced care planning work on a regular basis.
Gotcha. Now, what's the benefits of advanced care?
Advanced care planning has multiple benefits. In my experience in talking with patients and families that have done this, the patient feels a great peace of mind knowing that their wishes are understood.
Understood.
And additionally, the patient and the family gain experience in making medical decisions outside of a crisis. Crisis decision-making often leads to issues and problems. They learn how to do this, and they do it without the pressure of a crisis. So they get to be better decision makers and make better care.
Now, where do we start with advanced care plan? Like, I have no idea. How do I start? Do I consult a physician? Or?
The state of Maryland has a very good website. It's the Attorney General's website. It has all of the documents, but the place to really start is with the thoughtful discussions with your family. Families need to be involved in this because ultimately they're the ones you're going to name probably a family member as your agent, healthcare agent, to make decisions for you. So it's easy to start. There are simple steps that can be taken.
Now, what's the difference between advanced care planning and advanced directive?
So the advanced care planning is that process that I talked about.
Gotcha.
And so you go through that process, name an agent, and then decide how you want to have decisions made if, God forbid, things were to happen.
Right, understood.
And then once you've done that, you can put it onto paper. And the paper doesn't, you can pull it off the website from the Attorney General's office.
Gotcha.
You don't need an attorney to do it. So it's pretty easy to do. The hard work is in the talking and the discussion with your family.
So talk to me more about palliative care and, more in advanced care planning with palliative care.
Yeah, so advanced care planning for healthy individuals is about those unthinkable medical what-ifs. Advanced care planning with palliative generally helps patients who have multiple medical conditions where decision-making is pretty tricky. It's tricky because there are treatments that have modest benefits, but there are real burdens and risks. And the risk is that you would make the situation, the medical condition, worse. Some patients choose to have those treatments.
Gotcha.
Other patients choose not to. So that's what a directive does, is helps patients make those choices.
This has definitely been an amazing information that I need to hear. Where can we get more information, or is there a website or phone number?
Well, Gilchrist has a website. We have advanced care planning in it. We're a real strong proponent of advanced care planning. So there's an opportunity there. In fact, our motto or tag is informed choices, better care.
Hey, thank you so much for coming to Be More Lifestyle. You're definitely a lot.
Thank
Well,
you.
we've heard